Most of these people that were dying were the country people, were the illiterate people, people who could not read and write. And I can tell you that when you look at these kind of people, they are in the majority in that country. And if in our country here today, if you don't deal with them, things will go off here, and a lot of people will die.
First, we did an assessment, and we did some county-wide training in the 15 counties where we did Ebola 101 training with the chiefs. They were suggesting that it was better for us to go at the district level to conduct training. At the district level, you have more chiefs coming from the lower end, meaning you get chiefs from the town, the clan, you have women leaders, you have youth leaders at that level where they will be able to engage. We work with UNFPA, CDC, and WHO. All of these different partners went to the forum to explain to the chiefs. And at the same time, we were also asking the chief their role.
We also start from burying. If anyone died, we call on the burial team to come and do the burial.
Your duty is to report to the town chief. The town chief will make it his business to call to the clan chief. From the clan chief will inform the district, the paramount, and I will be informed.
This time around, they are talking, they are coordinating, the chiefs are supporting the health workers. So this way it's easier for county health team to be able to trace. And the difficult thing is to trace contacts. As you know, the virus spread through contact. That's the main mode of transmission. So if these people, for example, in all of the villages in the community, they have structures set up. If you went into a traditional setting today as a stranger, you have a stranger father. Your stranger father will have to report to the chief and say, I have a stranger. That way they know who you are, and they start to monitor your activity. If anything goes wrong while you're there, they will hold your stranger father responsible. We have very good team and very strong and committed teams, and we rely on our teamwork and the motivation the guys have to work in the field under difficult circumstances where in some of the community they have to walk, some have to go on motorbikes, some have to go on canoes.
People live in challenged areas, and I'm prepared to go through to meet with them and make sure they have access to information about health. And so even though some of the areas I travel were areas where they have not had motor road or car road region, but I managed to go through those places through crossing rivers, crossing creeks, walking through the jungle and getting to the people in those communities. Those communities have people living there, they are human beings, and so they need to have information. And more or less they don't have access to communication in terms of radio and telephone.
And so we have a team of 3 in each region conducting training at the district level. The health ministry will provide the training, the Ministry of Health will mobilize the chief, we will provide logistics.
Ebola, we're talking about Ebola. We say that sign and symptom of Ebola. Other signs, we say weakness, we say running stomach, vomiting, the person get fever.
And one of the things that we've worked with to reinforce is the issue of coordination, the issue of collaboration. You have too many people working, too many people talking. In 2-3 months back, my issue was we should add more and talk less, because we were talking plenty and we're not acting. So now you can see people doing more. Everybody putting their eyes together and everybody trying to do something now. And once we do it in a coordinated fashion, once we collaborate our efforts to be able to work together, I think we can achieve more.
The Carter Center played an important role by bringing the chiefs together, and we know that the chiefs has power in the various districts and towns. So in this fight, they told us that the chief will also help, because back then we got feedback that the GCHV were carrying on the work, but the chiefs were not helping. Meaning that the chiefs would not allow them to contact tracing social move activities within their district because they felt they were not respected. So now, with the Carter Center involvement, things are on course. The chiefs are even explaining things that they would do, work with the GCHV, come up with some of the laws, rules and regulations, and even bylaws and constitution for the violators of their various districts and towns.
While we're doing this, there are also suggestions now that we should go at the clan level, because again, The lower you go, the more people you get. And the more people you get, the more information will get up, and the more people will start to conduct themselves and try to support things.
Because of the Carter Center that we are even out here today, it got to a point that we did not even know what was happening in the counties, how our people were dying, whether our people were being educated to the danger of the disease that have come. It is Carter Center who had to bring us out to expose us.
In some of the areas, you have resistance. When people went for bodies, when they were looking for sick people, they were resistant. We've been trying to work to change that, changing that resistance to assistance. So one of the things that we've been able to do from our engagement with the traditional leaders is to be able to bridge the gap between the chiefs and the health team.